Today we have three veteran journalists with us today who now work in various aspects of the healthcare industry, which is undergoing a period of very turbulent change as a result of the passage of the Affordable Care Act, also known as Obamacare. And this controversial healthcare reform law, which was upheld by the Supreme Court a year ago, will greatly transform the way healthcare is delivered in the United States. Starting next year, whenever any of us get sick, the way we get well and the way that gets paid for will be greatly transformed. That coming transformation has made these folks' jobs considerably more difficult, and that's why we're here today, to talk about the difficulties they face as they communicate the details of healthcare reform to their various audiences. We want to talk about how the skills they learned as journalists may have prepared them for the task at hand, since they hold very different jobs in the field of communications than the jobs they used to hold. In doing so, we want to explore the similarities and differences in the fields of journalism and public relations so that students here can have a better understanding of the communications industry as they study it and prepare for possible careers. Furthest from me is Skip Thurman, who was the White House correspondent for the Christian Science Monitor and also a correspondent for MSNBC during the Clinton administration. After leaving journalism, he worked at Quest Communications, which was our phone company before it was CenturyLink, as their spokesman, and he's now Senior Director of Communications for DaVita, which is the Fortune 500 company that moved its headquarters to Denver from California a few years ago. DaVita is the country's largest provider of dialysis for patients whose kidneys have ceased functioning. Next closest to me is Steve Krizman, who has worked at newspapers in Colorado, Florida, and Georgia over a 21-year career as an editor and a reporter. His last newspaper job was as an assistant city editor at the Rocky Mountain News. He has the distinct honor of having worked for me and Goeken in his career. He got the heck out of it. In 1999, he left newspapers to do media relations for Kaiser Permanente, which is one of the country's largest healthcare providers. He now leads a team of 30 people who are responsible for telling Kaiser Permanente's story to all audiences. Deb Goeken, closest to me, was managing editor of the Rocky Mountain News for 10 years until it closed in February of '09. She was an editor and a reporter at the Rocky Mountain News for 23 years. After the Rocky closed, she was smart enough to go back to grad school and earn her master's degree in public health administration. She's been Senior Director of Operations and Communications at the Colorado Health Institute in Denver since July 2011. I'd like to start out by asking these folks a few questions, and they'd like to show you a few slides to explain what they're up to these days. We'd also love to hear questions from the audience. We'd like this panel very much to be a two-way street. The room is small enough that at any point along the way, if any of you have questions, simply raise your hand a bit and I'll see you and call on you. Why don't I start by asking each panelist to talk about how and why they entered the healthcare field, and perhaps how and why they left the field of journalism. We'll start with Deb.
Oh. Thanks, Rob. Can you hear me without the microphone?
Yeah.
I think I'd rather do that.
That's fine.
Okay.
Can you hear me without the microphone?
Yeah.
All right.
It's great to be here. It's great to be here with Rob and Steve again and to meet Skip. And I'd just like to say, if any of you want some good Rob stories, see me afterwards. I can do that. Rob asked us to talk with you about the transition, our transitions from journalism to healthcare communications. And as I started thinking about that, I realized, at least in my case, it wasn't as much of a transition as you might expect. I went from what I thought was one of the world's great journalism jobs as managing editor of the Rocky Mountain News to a new job, which is pretty great as well, at the Colorado Health Institute. Over the years, my journalism career was pretty traditional, or at least what used to be pretty traditional. I started at the newspaper in Peoria, Illinois, where I graduated from college. And after that, I came out to Colorado, and I started at the Rocky as a business writer. Then I was a business editor, then city editor, then assistant managing editor, and finally, as Rob said, I was managing editor for 10 years until the Rocky was closed. And it was a great ride. At the Rocky, we got to cover wonderful big stories. We covered Columbine, we covered John Bonet, we covered the Democratic National Convention in Denver in 2008. Lots of wildfires, on and on. We won some Pulitzers. We wrote beautiful stories. We took great pictures. We worked very hard, and we had a lot of fun. And then it was over. So I had a decision. Do I stay in journalism, which was all I'd ever done or all I'd ever known, or did I use this opportunity to try something else, to use my skills in a new way? And that's what I did. I went back, I got my master's degree at the Colorado School of Public Health. I don't know, most of you might not know, that's a joint venture of CU, CSU, and UNC. And I took my classes on the Anschutz campus in Aurora. And I focused on epidemiology, which was really a lot of fun. That's almost like investigative reporting, but with math. And then my new world collided with my old world. I did my practicum for my master's at the Colorado Health Institute, and we liked each other, and they hired me, and I started in the summer of 2011. And for those of you who don't know, the Colorado Health Institute is a small nonprofit. We provide nonpartisan data, analysis, information, and context for the state's policy leaders and decision makers who are working in the health policy world. So we do a lot of work with the state lawmakers. We also help state agencies, foundations, advocacy organizations who need information about what the evidence shows is working in health policy. In Colorado, a lot of people are working to make Colorado the healthiest state in the nation, and I think it's something that can be achieved. That's what we do, that we support that work. My role at the Colorado Health Institute is to be in charge of the communications. And what was fortuitous is there had been a change in management and a real desire to make our content and our information accessible, easy to understand, relevant, there when you needed it. I have a good story. When the Supreme Court ruled on the Affordable Care Act in July on its constitutionality, we decided that we were going to come out with an issue brief that day. So we had two different leads. As all of you journalists know, we had two different leads. We planned it out. We'd done our research. And then the Supreme Court ruled, and they did something we didn't expect, nobody expected. They ruled that the law was constitutional, but that the Medicaid expansion was optional. So we had to throw everything out, redo it, and come up with new analysis, which we did in 4 hours. We wrote it, edited it, designed it, and had it posted in 4 hours. And one of our young colleagues looked at me and she said, "That's 3 months faster than CHI has ever done anything." So we are making progress. Writing in a simple, elegant, active voice may sound easy. It's something all of you work on, but it's been quite a sea change at where I'm working. So I do a lot of coaching, a lot of editing, a lot of writing, and it's really starting to pay off. We are becoming known as an organization that can take complex information, important information, and really make it accessible and easy to understand for people who are busy, who have a lot of information. It kind of cuts through the noise and gets to what they need to know. So it's been really an interesting transition for me. And as I was thinking about it, I thought a good takeaway for all of you is that wherever your career takes you, the skills that you're learning now are so useful in so many ways and doing good in many different areas.
Thank you, Deb.
You're
Skip,
welcome.
how about you?
I'll be really brief because a lot of what she just said is in my slide. I'm going to burn in my deck. I'm going to burn through it. They're better students than I am. Pardon me. Rob asked us to bring a little bit of presentation about some of the policy stuff that we're involved in. Being narcissistic the way some reporters are, and I'll point at the TV reporter. It's mostly about my crap, so I'll do that. But real seriously, why I got into the job I'm in now is because when I was a reporter, and I wanted to be a reporter from the time I was younger than you guys. When I was in high school, there was no question. It was like, I don't want to be an astronaut. I don't want to be a veterinarian. I want to be a reporter, and I want to make the people that are doing the wrong thing suffer in a unique way. And that's why I got into journalism. And it was fun for a long time to do that. But I'll get into that in just a second. After I left journalism, I worked for the phone company. honorable job. We did a really good job of what we did. We locked horns from time to time with guys like Rob, which was really tough because Rob's like that really decent professor you never want to disappoint, so you always have straight A's for him. He was sort of that way, so when we had to go back and forth, there was a lot of yes sir and no sir. But the job I'm in now gives me a chance to sort of do what I did before as a reporter. Idealistically, I believe that I can really make a difference now. It's really unique in that you're not just a little bit older than you guys, and you're eating ramen and trying to have a nice apartment in Boston, and you're living on a shoestring. You actually get to have a grown-up job in the corporate world and make a just fine salary. But it's a really unique blend now where we can go out and we can make a really big difference. We can help shape the healthcare debate. And still be comfortable, not like a Rockefeller, but enough to have a swell bike to ride on the weekends and that kind of thing. But that's my primary motivation for getting into healthcare.
Terrific. Steve, how about you?
Unlike you, Skip, I wanted to be a journalist from high school. Kevin and I went to high school together, and you worked on the paper also, didn't you, at Regis?
I wrote a column. I didn't really.
Yeah, you wrote a column, yeah. Now he's a journalist here at Fort Collins, Colorado. And I loved it. It's a job where you can you have kind of a front row seat to history. Things are happening. You're the first person to see things, to hear things. I've been in the locker room interviewing John Elway. I've interviewed the governors of Colorado. It's just really a cool place to be, except for me, I had so many years on the city desk, which is a bit of a pressure cooker. A city desk is where where all the hard news comes, and it's you're sending out reporters out to incidents, and they're reporting back to you. And the cool thing about it is you have your finger in just about every story that's going on. The bad thing is that it gets a little hard on you. On August 24th, 1995, Deb was the city editor, and she's in a slot, and then there's a rim of desks around, and I'm assistant city editor on the rim. And we sent a reporter to the scene of a shooting in Lakewood. And not long after, the reporter calls in and hands the phone over to the detective. And the detective informs me that my sister had just been murdered, that she was dead on the scene, and that's how I found out about it. And she's finding out about it from some other means. And it was then I found myself and my family in the middle of a story. And it was really strange being on that side of it. You have reporters calling, wanting to. I couldn't believe this, but a TV reporter wanted me to be interviewed on camera. It's like, no, I don't think so. However, and it's kind of funny. My family reacted a lot of different ways, but most of us really wanted to tell the story to the media. So if you find yourself in that place where you have to do that kind of uncomfortable interview with a family member who's gone through a traumatic experience, many family members like the opportunity, because if you think about it, not too many people knew my sister, and this was a chance for people to learn more about her, about what the world was missing as a result of this senseless violence. So I don't usually share that story much, but I thought with journalists, you guys would appreciate it a lot. So but what it did do is it sort of drained a lot of the fun out of journalism for me. And a couple of years later, heard about an opportunity to work for Kaiser Permanente. How many people here know what Kaiser Permanente is? Okay, well, that's good. At first I thought, PR for an insurance company, it didn't really sound like something that I would really enjoy doing. But I did find out that, first of all, it's a nonprofit organization, and that it actually provides health care. We actually do have doctors and nurses and therapists who make people's lives better, and it's a place that I feel like I can tell stories and advocate for an organization that I believe in. So there is a life after journalism. I've been there since 1999. I did have a 2-year stopover at the University of Colorado, Denver, where I did the same kind of media relations and marketing and advertising for a couple of years there. But I went back to Kaiser Permanente because I just really think that what's really cool about it, and I'll get into it in my next part, is that it's a great way to get back into journalism and tell stories. So,
thank you, Steve. At this point, I'd like each of our panelists to spend about 5 minutes or so telling us and showing us what their new job in the healthcare field entails. Which skills from your old journalism jobs are most useful in your current healthcare communicator jobs? And why don't we start out with Deb, and if I'm lucky here, there we go.
Okay, like I said, when I was thinking about the transition from my old job at the Rocky to my new job at the Colorado Health Institute, I thought, okay, in my new job we do a lot of spreadsheets, so I'll do this spreadsheet thing, and it made me realize that all of the skills that I used as a journalist I am using today in my new job. Identify gaps in information, that's what we do at both places. Gather data and evidence, report simply and clearly, move quickly, be accurate, include the why should I care. Nobody's going to want to read what the column or the issue brief unless you tell them why they should care. Offer solutions, publish across platforms. That's becoming more and more important. Meet your deadlines and get pizza on election day. So we do all of those things. I do have to say, one of the biggest difference when you leave a newsroom and you go to kind of the corporate world is it's much quieter. You guys found that? Yeah. The best thing I think about a newsroom is the TVs and the scanners and people yelling and getting excited. And you don't quite have that much. Yeah, a lot less. So when I got to the Colorado Health Institute, their writing was charitably dense and academic. People, you had to really want to read it and have a really strong background in health policy to understand it. So my job has been to encourage really, really smart people that it's not that easy to write simply and clearly. I think you all know that you have to know your subject matter and you have to present it well for it to make a difference. So we're working on that, and I really talked to them about how words can create visual images. I picked this one from a recent issue brief we did. Basically, as the individual mandate goes into effect, there's a group of young adults, they are often called young invincibles, who are going to be very important. They're going to have to buy health insurance right now, and we're talking 19 to 30-year-olds. Right now, they have the highest rate of health uninsurance in Colorado. And they're called young invincibles because a lot of people think, oh, they don't think they'll get sick, they don't need health insurance, it's more fun to spend it on other things. So we normally would have written a brief that started the Colorado Health Access Survey, taken of 10,000 Coloradans between July, and I'll show this. Instead, I said to the analyst, just tell me what you're talking about. So she came up with this, and I thought it was very visual. What comes to mind when you hear the term young invincible? A healthy 20-something who can't imagine getting sick and decides to risk going without health insurance? A recent college graduate struggling to land a job that offers full benefits? Or a young adult who understands the value of health insurance but can't afford it on a part-time salary? The answer is all of the above. So I think it painted a picture and got you into it in a way that we wouldn't normally have done. We also are working very hard to make our publications more accessible, quicker reads, more interesting to people. And I have to say that my main success in this area has been to hire a CSU graduate named Brian Clark, who we worked with at the Rocky Mountain News, and who is just brilliant and helps me do what we want to do. So we're two old newspaper people in there helping this happen. And he's done all of these. And as you know, it's just like journalism. We've updated our website, we tweet, we're on Facebook, we are doing a lot more presentations, trying to make them more interesting, and we are varying our publications. They used to normally do 25-page publications. Now we're doing 2-pagers and 6-pagers and doing them in different ways so that people can read them quickly. I think this is we did this for the Colorado Health Foundation. They commissioned a report on whether if Colorado expanded Medicaid, what it would mean for the economy. And this tells that story with data, and we did that for them. We want to do a lot more of this. We want to make sure, we want to become interactive in visualizing data and do a lot more maps. People love maps. And then when I got there, it was not allowed to use pictures in our work, and Brian and I are changing that. Last year, the Colorado Health Institute celebrated its 10th anniversary, and Brian took his camera, went across the state, and found stories of health. I put some more books back there, and anybody can have them if you want, and we published this. So what we were really trying to show is that health policy at the end of the day is about real people, and decisions that are made in Washington or in Denver affect real people. So he found, and then he came back and he wrote the stories and designed the books. So he's something. This is a health coach and a new baby showing the little sisters, and this is on the in Grand Junction. This is the emergency room before the start of the shift in Denver. This is a couple who live together at the Veterans Home in Walsenburg. They are both veterans. This is a mobile van where young children can go to get their checkup in Denver, in Aurora, I believe. And this is, we were talking about the importance, and Steve probably talks about this a lot, of primary care doctors being much more involved with their patients and really caring, and we thought this was a great example of that. And this is us. So that's it.
So what are you doing for an encore next year?
I know, that's the problem.
So this is an organization that
The bars.
used to issue 25-page, what you call dense white papers that no one can read, no one can understand, and in a short while you've transformed the information you disseminate into something far more visual, far more informational. That infographic you saw probably was initially a 25-page white paper, and you turned it into a one-page graphic that's really accessible to anybody. Skip, why don't you come on up next, and I'll see.
Thank you. Thank you. So as Deb said, a newsroom is frenetic and it's crazy and there's stuff going on and it's loud all the time. When you step into a role like I'm in, it's not just about selling what you do necessarily, although that's a really big part of it. Part of it is like the obverse of that newsroom, right? So we're on the business end of a lot of stuff that happens. When you have 50,000 teammates, we call our fellow employees teammates, and my work is called the Village, the DaVita Village. When you have 50,000 people and more than 500,000 patients with people laying hands on other human beings, you're just going to have trouble. You just are. And I'll get to what a typical day looks like in just a second. But in the meantime, the other thing you do is, as a reporter, one day you might have to interview the governor just like that. The next day you're going to be covering a strike where the garbage guys are striking. And so you've got to be able to attenuate to every human being in this room. Right? Some of you are female, some of you are male, we all come from different backgrounds, but you have to attenuate and you have to read the person as you're talking to them, right? So that's a really big part of what we do. They've got to tell the stories of their patients, and I've got to tell the story of my teammates and all of the people who are treated by my company. And by the time you see us, by the time your kidneys failed, you've made some really bad decisions. If you haven't crashed into it, you were obese, you had high blood pressure, you didn't take care of yourself, and so by the time you get to us, you're a pretty vulnerable human being. Doesn't mean you shouldn't have your story told and be protected, however. So I started out, wrote for a newspaper. We won a few Pulitzers. The paper was around since the 1800s. Not as many Pulitzers as these guys, though. Worked for public radio.
Which paper was that?
The Christian Science Monitor. It's not a religious publication. It sounds like they're just really serious, and they're like the offspring and the grandsons of Cotton Mather in England. They're just really, New England, they're just really serious people. They made me change my byline from Skip to James because they said it wasn't a effing surfing magazine. And then I worked for MSNBC, covered the White House for those guys around the time that Brian Williams, who's now the anchor for the NBC Nightly News, we were colleagues, along with a guy named David Bloom, who died 10 years ago last week, by the way, super guy covering Iraq. And that reporting through all of those different venues really helps me tell our story. So when I'm trying to sell a story like this morning, I had my CEO on the National Public Radio network. They did, the local Denver reporter did a story on us, or we were involved in it, and potentially 25 million people heard it. NPR is still depending on your politics, still deemed to be one of the most trustworthy news sources in the country. It's the higher than average, like 70% of the people who listen to NPR have at least a college degree and higher. Median family income. So the bottom line is you're hitting a pretty targeted group of people by the time you get your person on a public radio channel. But they're very different to talk to than the Longmont Times Call or the Financial Times or Fox Network. You have to be able to speak to all of the different animals in the pack. These were some of the fun stories covering the White House. Serendipitously, the Oklahoma City bombing, George McGovern was having a cruise through. He just died last year too. I hope this death doesn't turn into people who have died or are about to die soon. But George McGovern decided he was there doing something just to check out the building, which is pretty horrible. Major stories, impeachment, that was a lot of fun. NAFTA, which is boring as hell. Clinton-era healthcare reform, really my first introduction to what we were trying to do in this country to solve the healthcare problem. Very early stages, everybody thought it was going to pass the way Obamacare passed. A lot of us never thought it had a chance, and it didn't at the end of the day. But what it did do was set the stage for many years later and another president and 2 administrations later for those reforms to come into place. Oklahoma City bombing, as I mentioned, Middle East peace signings, etc. Going back to the gritty end, crime beat for a while. Nobody has a story like we just heard, but there's nothing like being undercover and hiding your microphone and going in like you're a kid from the suburbs to buy drugs in East St. Louis and seeing the guys next to you doing the same thing, get his head blown off. It just doesn't. It happens as a reporter more often than you would think. It's like being a cop, but you see a lot of fun stuff. Oh, this is another thing. I covered Paula Jones for a while. She was one of the many women that accused President Clinton of horsing around with her in an inappropriate way. Since I reported the story but couldn't report it for the Christian Science Monitor, I flipped all my notes over to a buddy over at Penthouse, and he covered it. The other important lesson, Rob asked us to talk about lessons. When you're single, make friends with Bill Clinton because he'll hook you up every time. All right, that wasn't as funny as I thought it was going to be. All right, so what we do now, DaVita Healthcare Partners, we're the largest dialysis provider in the country. We just bought a group last year for $5 billion, and what they do is, I think, deliver healthcare in a way that we're going to start seeing, and that's going a little bit too long here, in a way that I think the future is headed. It's accountable care. So we don't just, if you come in and your arm is sore, we're not going to x-ray your arm, we're not going to send you fee-for-service to a lot of different people. We're going to take care of your entire being, right? So we're going to look at what you do for a living. We're going to look at all the different causal effects that possibly made your arm sore, unless you just fell off your skateboard. And probably 7 times out of 9, there's something causal there that we can eliminate from your environment. We can treat you a lot cheaper than a fee-for-service model, and we'll get a capitated rate, which means a certain amount of money per week or per month or whatever from Medicaid or Medicare. You're going to be healthier. We're going to save taxpayers money, and we're going to make you a lot healthier. And it's all about innovation. So if you're on dialysis, you're probably taking 36 different medications, as I said, the sickest human beings in the world. A lot of our patients go from one pharmacy to the next. They just do. It's, again, bad decisions. We created something called DaVita RX. And so what we do is we bundle all of those medications at one time. And so we make sure that if you're taking one drug, you're not going to take another drug that might make you even more sick, but we're going to make sure that you get all of your drugs and that you're able to take them all. We're about to release a study that shows that we have a 39% higher survival rate. We use the word mortality, survival rate, than other patients. And it's just extraordinary. And it's not happy, it's not, it's not crunchy tofu, this might work, this might not work. The streets noticed. Warren Buffett has increased his position in our company up to about 15% in the last year. We went from $62 when I joined the company 3 years ago, and we closed at $126, I think, yesterday. So it's real stuff, and it works. Typical day. Yahoo Finance was in the office last week, as I said, NPR this morning. But then we have crisis stuff, right? So it's just like being in a newsroom. A machine that wasn't cleaned properly exposed patients to hepatitis. Really big deal. If it's any of you in this room or your family, you're going to get motivated about that. And they usually go to the media. And part of my job is solving that problem. And then finally, last year, this is a real story. This actually happened a few years ago. We had this wacky nurse, like Kathy Lee Bates in Misery. That's the only image that I can imagine, who was injecting our patients with bleach just out of meanness to kill them. She went on trial last year. She's now in the Texas penitentiary system for the rest of her life. But that's just a normal day. I mean, that's the stuff that comes across your desk every single day. And being a reporter trains you to handle all that mayhem and chaos, plus the bottle of scotch that you had hide in the ceiling tile. That's it.
Thanks, Skip. Steve, let me get you set up here.
All right. So yeah, Deb, the quietness of the corporate world definitely was one thing that really surprised me. And then the other thing was the slowness, how slow it is to get anything done. I remember the CEO would call me in and try to get me to do a memo for him, that was really something complex, and then I'd get it back to him in that afternoon. It was like, what? They thought there would be like a week's bit of work, But the one thing I think I've learned over a couple of years now that I've been outside of journalism and in PR for 12, 13 years, is that there's about three things that I think we underestimate that journalists have, the skills and talents that we have, that really aren't out there in great supply. One of those is listening. We're really, really good at listening to people, hearing them out, hearing the meaning behind the words that are coming out of their mouth. We're really good at that, and don't underestimate that. That's really important. Another thing that we're really good at, obviously, is being able to write well and take complex information and turn it into something easy to understand. And that really doesn't exist in great supply in the corporate world. And the third thing is that we are really good at telling stories, and we're really good at knowing which stories are going to resonate with our audiences. So when I jumped ship and went to Kaiser Permanente, that was kind of, and I think I've heard the same stories told by Skip and Deb, and when they went into their switch. We bring into this a different way of looking at things, and we kind of shake things up. And I know that when I walked in at Kaiser, it was in the middle of HMO bashing. So Kaiser is a health maintenance organization. In the 90s, a lot of insurance companies got into that business, and they did a lot of bad things to squeeze out profits and keep care from people. And so we were kind of being brought down into the mud with them. And it was real difficult for me to get across to the general public the difference between Kaiser Permanente, which provides health care, has doctors and nurses, it's nonprofit, we don't have the financial incentive to squeeze money out of people. But I couldn't quite get that complex story across. It became pretty clear, though, that the best way to do it was through stories. We had a nursing strike in 2000, so another thing is Kaiser Permanente is the only healthcare organization in Colorado that is unionized. We had a nursing strike in 2000, and a lot of stories were going around about how things were going poorly in our medical offices, that people were standing in long lines, that we weren't seeing patients quickly enough. And that wasn't true. It was actually a lot of the managers who actually also had healthcare backgrounds were getting out from behind their desks and figuring out how to take care of our patients. Doctors were doing things differently. We were actually doing pretty good over this 3-week period of the strike. And what we decided to do, which was very daring for Kaiser Permanente at the time, was to open our doors, let reporters come in, TV reporters come in, newspaper reporters come in, and actually observe for themselves and let the chips fall where they may. And in that process, we actually, I think, won the PR battle, because reporters came in, they sat down and we let them talk to our patients, and our patients said, yeah, everything's going fine. I was able to get in and out. They called me up, let me know that my appointment was going to be a little bit late. So it was, that was kind of an eye-opener to me, is that just letting the observers come in and tell the story, let the chips fall where they may, is the best approach. So over the years, back then, I probably spent about 80% of my time with the traditional media, trying to get them to cover us or answering their questions, and 20% of my time telling the story, writing stories myself. Now I'd say that the media relations people on my team are doing it the other way around. We're spending about 80% of our time telling the Kaiser Permanente story, and about 20% of the time working with the traditional media because of the new media landscape. We've got so many different ways that we can tell our story directly. And what I've got up here is a frame grab of the front page of our website. It's kp.org/Colorado. And what it does is it presents to the world our story and it slices and dices it in different ways that are of interest to the audience. So for example, you see across the bottom those dots. This is our main page, but if you're a parent, there's a page of stories that are really geared toward parents. Similarly, there's one on personal health if you're really interested in how to make yourself healthy. And there's healthy aging in case you're older or you have an older parent who you're taking care of. And each one of those sections has stories that are geared toward that demographic. And the other thing about it, too, is that it's all search optimized so that really in the end, most people come into our stories from some other place. They come from Google, okay? They're tapping in, they're looking for information about, what can I do about, breast cancer? And we've got this optimized in a way that our results come up on the first page and we bring them in here. And the idea being that we tell a story from the patient's viewpoint, and then that patient kind of brings in the doctor and talks about the expert care they got from the Kaiser Permanente doctor. Basically, this is a patient whose doctor pretty much badgered him into having a colonoscopy exam, and it detected colon cancer early, and he was able to have an operation that made him cancer-free and essentially saved his life, and he credits that doctor over there on the right. And we did this story's been out there for a couple of years, and we recently last fall distributed that story by way of an email newsletter that goes to all Kaiser Permanente members across the country. So that's something like 3 million people got this story, and of those 3 million, 267,000 people opened the email. 15,000 people went and watched that video, and out of those, over a 4-day period, 50 people requested colon cancer screening kits. So it's like, when I heard that data, I was like, oh my God, we're in the healthcare business. My people are actually getting people some healthcare. Wouldn't that have been great in the newspaper business to be able to have that kind of feedback to know? Yeah. In today's world, we're just getting this sort of this feedback all the time, and it's really gratifying, and it also helps us write better stories. Because what we also do is we begin to see what stories are capturing people's attention, and we do more of them, and that's kind of the game in search engine optimization. I think the new frontier is really all around the social media. So we won't be able to see this story, but we won't go there. We have a story from a woman who does a video blog of her own, and she took her dad in to see for cataract surgery at Kaiser, and it was such a wonderful experience. She video blogged about it, and she's got this fairly big following. So we've loaded up her link up on our website, and I think that's where where the game is going to be going in the future is the more that we can influence that part of the media that's actually owned by the audience that we don't own. We're over here in the owned media, the kp.org/Colorado, and we can do what we can over here to get our story out. But the more we can influence the media that's actually happening and being created by the audience, that's where we'll have our greatest impact. And then, of course, they'll feed each other back and forth. So that's what we're doing.
Thanks, Steve. Skip, you introduced the concept of accountable care, which is a new concept for most of us, comes in with healthcare reform that kicks in next year. And it sounds like more of a holistic approach whereby somebody comes in with something wrong with their arm and you try to find out what might be wrong with the whole person. And how have you tried to communicate that to your clients, to your patients, and is that as beneficial as some people think it is?
So I think it's extremely beneficial. It's not the end-all and cure-all for what's wrong with the healthcare situation writ large in this country. But it is pretty extraordinary. I mean, if you think about the way the tail wags the dog when it comes to healthcare and just how utterly screwed we are until we find a problem or find a solution to the healthcare problem. It really is a pretty unique solution. One of the stories that we tell, similar to this, and this is brilliant by the way, it's just so great to see all the data-driven information you can get back to see what works and doesn't work to drive your story, to drive your message. We had a kid, I think the kid was in somewhere in Florida because there was a lot of mold. Young African-American kid, probably 8, 9 years old, he had this chronic asthma, bronchitis. They couldn't, the mom kept bringing him in. They kept treating him with steroids and all the stuff that you do to treat a kid with asthma. In the traditional fee-for-service, go to your doc and then get it figured out. He came to us, and we sent a team out to his house, and we saw that there was mold in the house. There were all sorts of external factors. We did a couple of things, and within a few weeks, the kid was in much better condition. And it's just an example of what the model can do and how it can work. And by the way, all the doctor's visits that are now not costing insurance companies, not costing the mom, not costing taxpayers, it's just extraordinary. It's just so common sense. Why wouldn't you do it, right? When you have a dialysis patient who's sitting in a chair for 4 hours while the machine cleans their blood 3 different times, the blood cycles in and cycles out of the machine, why wouldn't you check their feet to make sure if they're diabetic that they're not going to lose a limb? Why wouldn't you? It's just stupid not to do it. So anyway, we're passionate about it, as you can see, and that's a really good example of how we can make a few tweaks and make some big changes just right off the bat. But the accountable model, I think, is going to be pretty important in whatever the ultimate solution becomes.
Deb, next year, 2014, marks the actual implementation of Obamacare. It's supposed to be completely rolled out next year, and that's when it's actually more important that the public gets good information on what's working and what's not. Colorado Health Initiative's role is to provide unbiased information and analysis. How do you plan to do that next year?
Well, I think it's really crucial that we take on this role and that we do it. What we are anticipating is that healthcare reform will affect almost everybody in some way. And because of that, it becomes very personal. And if something happens that doesn't work quite right, then that becomes your whole picture of how health reform is working. So it will be our role to make sure that we are gathering data and seeing how it's actually working in Colorado, how many people are getting insurance, how many people are still uninsured, how many people can find a doctor or caregiver if there's thousands of more people with health insurance. So we actually do a household survey every 2 years. We manage this for the Colorado Trust that is a good source of information on insurance, and we're going to be tweaking that so that we can have a baseline that starts now, and then we'll be able to measure as we go forward. But there are lots of different ways that we plan to keep especially policymakers updated on what's happening, because as you know, it was a 900-page bill. It was created under a lot of controversy, a lot of stress. Things that sound like they might work might not actually work when it hits the streets. So we'll be watching that and providing options for hopefully making it work better.
Steve, you brought to my attention some research which suggests that with Obamacare, there's a great deal of skepticism to overcome. Mm-hmm. Could you talk about that and maybe how you, as an organization, plan to do that?
Yeah, we got a big hill to climb.
Yeah.
Actually, I was going to ask for a show of hands here, and it's okay to be honest about this. How many people here think they can describe what the Accountable Care Act is? Wow, okay. And now think about that. Well, what happens is when you ask people about Affordable Care Act, you get about the same response. 0% people know what that's about. You ask them about Obamacare, they'll say, all I know is, and we're talking to people who are currently uninsured, who would be eligible for some coverage under the Affordable Care Act, and they'll say, the only thing I know is that I might get a fine if I don't get health insurance. So their only knowledge about it is negative. So that's, that right there is a pretty major hurdle for us to overcome. We've done some, Kaiser Permanente has been doing some ethnographic research. We've gone into home interviews with 12 families in the last 6 weeks. And I think one family story really kind of hit home to me. There's a woman who has a teenage daughter, and we're talking to both of them. She is moved to tears and embarrassed by the fact that she has health insurance through her employer because it only costs her $35 a month, but she can't get health insurance for her daughter because her employer, her employer's plan, it would cost her $200 to put her daughter on there, and she's just so embarrassed that that she can't get her daughter coverage. And in fact, what they do is she hopes that if she gets sick, the mom gets sick, that she gets sick ahead of her daughter, because then her daughter can finish off the amoxicillin. I mean, people are really trying to find ways around the lack of health care that we have in this country. And it doesn't really matter, I say, whether or not you like Obamacare or the Affordable Care Act. Something has to change, and this is America. We shouldn't be having that kind of situation. But these people are not at all, thinking about health insurance in the way that we think about health insurance. They're thinking about it as a waste of money. In the short periods of time that they maybe had health insurance, they didn't get sick, and so in their mind that was money, down the drain. They have in most cases, been out of insurance for a couple of years, and they found ways around it. One guy had acute appendicitis, and since he didn't have insurance, he decided not to go see the doctor. He waited until it burst, and he wound up being in the ICU for 5 days, and he's still 5 years later paying off a $44,000 bill. So these are people we've got to first of all get them to trust that insurance is a good idea for the security of their families, and then we've got to help them see that with the security in their family, there are ways of maintaining their health and avoiding, because right now it's all about, the only time they go to a doctor, the only time they even think about health care is when they're sick. And the data is very, very clear that if we can stay healthy and nip things in the bud and get people health care early in the process, we save a lot of money, let alone the life value of being able to live disease-free. So that's what we're trying to do.
Skip, I'd like you to talk to about some of the nuts and bolts of your job. I think you've had some experience sort of actively defending DaVita from some bad stories that were put out there. I imagine that your former life as a journalist has probably helped you do that. Could you talk about that a little?
Sure, you bet. So, there was an old, I forget who it was Willie Sutton or something. He was a bank robber, and he said, "Why did you rob banks?" And he said, "Well, that's because where the money is, right?" So if you're a Fortune 500 company and people have lawyers, they like to sue you whether you did something wrong or not. It's not just malpractice. It's under the False Claims Act, the whistleblower statute. What was a really great law a long time ago has gone from a few cases being filed every year to almost 2,000 a year. The vast majority of those are never followed up they're never prosecuted by the federal government. What happens then is it's turned over to plaintiffs' attorneys, and they look for a big payday. And so it's become this not cottage industry, it's become this huge industry where if somebody makes an accusation, and by statute the federal government has to investigate it, and then they find nothing wrong, you then have to spend a lot of money on attorneys to defend yourself. And we have a famous case, and I'm not going to say too much because it's still very much pending, but we have a very famous guy who I used to be on camera with all the time at the network, and he's suing us over a False Claims Act accusation that the government declined to prosecute. And so we had to endure a 14-minute piece on CNN, 14 minutes. From the time that piece started till it ended, I had to go in the bathroom and shave a couple of times. It was that long. It just went on and on and on. Now, nobody paid attention to it because it was too long, it was too complicated, and people just couldn't get it. But we have to defend against that stuff every single day. But not just that, but it's the day in and day out stuff, right? You have really honorable, really neat people who do their jobs in a heroic way, and things still go wrong. People still get really sick, and people still die. And then the news crews come. And so it's part of our job to balance out being really fair and being really honest with the media, which we do, but also protecting your brand. Because if you, for every one situation that occurs and becomes that public, there are hundreds of thousands, millions of treatments that happen every single day, every single week, every single month that happen flawlessly. And so it's those aberrations that you have to defend in really public ways. And again, they hire us in the same way that Wells Fargo hires hackers who hack into their computer system, because we know how people are going to try to hack into it, and we defend against it.
Deb, you would seem to be in a good position to see changes in the way that healthcare policy is communicated to the public. Where's that headed? Where do you see it heading?
Well, I think I would build on what Steve said, is that, not that long ago, basically the only information that could come out in the mainstream media, in a newspaper or on radio or TV. And now we have so many opportunities to educate the public and get our information out. Probably ways that are being invented right this minute and will change our lives completely not that long from now. But I think that you'll see more of visual storytelling, more of videos, more just getting the information out to people where they are. But I'm kind of intrigued also about using the technology to target recipients and do a better job of getting information, not just to everybody, but to the people who really need it. So I think we'll be working on that a lot more.
Steve, along those lines, you've talked to me about how, as traditional newsrooms are shrinking, there are other new players that are producing content that could advance our knowledge about public issues. They're covering subject areas that once were covered regularly by beat reporters at traditional news outlets. Talk about that.
Yeah, I think it's good that people who have journalism experience are doing this. I think we bring to it some ethics. I tell my team, obviously we don't ever lie, but also we don't spin, and that's I think audiences are smart enough to sniff it out, to know that this story is just so one-sided. You're just telling and they'll just stop the video and then move on to something else. So we have to. I think the key element is that you got to be true to the story, really be listening to your audience and making sure that you're reaching directly to the audience and meeting their needs and wishes. And then when it comes into the social media sphere, don't get too hung up on the latest thing. I also tell my folks that the R in public relations is about, in PR, is about relations and relationships. And those are everything from your face-to-face relationships, the events that you go out to, the people you meet, the business cards you pick up, the information that you gather from people that you can then know a little bit more about what interests them, and you can target them really from their viewpoint. So if I get an email of someone and I know that person has expressed interest in, or has a child and has expressed interest in knowing more about Child Health Plan Plus, I'm going to reach out to them on that in that context, and not just some general blast from the PR department. So that's kind of, I think, the key thing is that going forward it's a lot of work, because you can't just rely on some fancy social media network that provides you this lovely data. You still have to do the hard work of building those relationships, and sometimes that's face to face, sometimes that is through technology.
Any questions from you all? Yes, please.
I was just curious, for each of your organizations, if you blend public relations with your marketing kind of C-suite activities, or are they separate?
Mine's integrated, so I'm in charge of both. In my team, we have advertising, marketing, member communications, internal communications to our staff and physicians, and public relations and media relations. So what we do, so our mantra is find story, tell story, spread story as far as you possibly can. So we repurpose as much as possible, and we make sure that the message is consistent all the way through.
Skip?
I would say the same thing. Yeah, we're very much integrated in the internal communications as well, right? We have 50,000 different teammates. That's the circulation of a pretty good sized newspaper, smaller newspaper. So it's very much integrated. But we especially those of us on the crisis side, we tend to see the marketing people as the Athenians who build beautiful art and show it to people, and we're sort of the Spartan warriors who have to go in and get our hands a little bit dirty. But we are integrately and intimately involved and integrated in what we do.
Any thoughts, Deb?
Well, you know, we're a different animal. Our funding comes from 4 health foundations in Colorado, so we don't have to do traditional marketing. I would say that we view that more as getting the word out about our organization so that if people need data or information, they know they can come to us and get it. And I think that's just a matter of doing lots of good work and letting people know about it. So that's what we do.
Anyone else? Okay, I promised I'd get you out of here around this time, so please at this point join me in thanking our panelists for coming up today.